Hello everybody, Dr. Saccone with MedCore Asthma and Pulmonary giving you the weekly COVID-19 update. As always, we're going to talk about the numbers and the curves as well as a few informative updates. However, I do have a special guest for you today. I'll be talking to Dr. Andy MacBride. Our patients will probably recognize him from our office as he is our resident in training here. He hasn't been here for a while as he's been busy on the front lines taking care of the sickest people in the hospital, and I'm honored to be here talking with him today. Now, he contracted COVID-19 and he's going to share his experience with everyone today. As of today, April 23rd, there are 845,000 cases in the United States with 46,000 deaths, conveying an identified case mortality rate of about 5.5%. In New Jersey, there's 96,000 cases with 5,100 deaths, conveying a case mortality rate of about 5%. Pennsylvania has 36,000 cases with 1,670 deaths with a rate of about 4.6%. And for our patients in Kentucky, 3,400 cases with 185 deaths, conveying the identified case rate of about 5.4%. Now again, these rates are the deaths in people with a positive test. There are many more people who had this disease and are not identified, so the true mortality rate is going to be much lower. Looking at the graphs again, we do see a definite leveling off of the cases with a drop. It is worth noting that there are some spikes and drops, but the general trend is that it is going down every day. These spikes and drops are partly due to changes in testing requirements. More people with less symptoms are getting tested, and we are aggressively testing our long-term care and nursing facilities, so we will see these cases start to rise. The death numbers are very erratic. This is difficult to interpret for many reasons because there are continued differences in the classifications of deaths, as well as differences in the rate of decline in different patients. Meaning there may be some patients that are on a ventilator for a few weeks, while others just for a few days, and some not at all. However, when you look at the moving average shown here, you can see a general trend downward both locally and nationally. In New Jersey, Governor Murphy has also been talking about how there's been a continued decrease in hospital admissions for COVID-19 within the state, and this too is another good marker for improvement of the pandemic. There have been multiple new studies that are coming out looking at antibodies in the general population. These continue to show that the general population has been exposed a lot more than what was initially believed. Multiple studies are showing that an estimated case range is about 50 to 80 times that which is being recorded already. The previous study that I had quoted last week was from Germany. However, these new studies were done domestically in Texas, California, and New York, and they're showing the same results. And this once again is great news because it's showing that the actual mortality rate of this virus is in the neighborhood of 0.2 to 0.6%, which is much lower than the 5% case-based mortality rate that we've been having reported. Also, I want to touch on flattening the curve and reopening the economy. I want to mention a common misconceptions that we hear a lot. When we talk about flattening the curve, the point of this was to spread the cases out over a longer period of time. We're likely to have the same number of cases, but just not all at once. And this was done so that we didn't overburden the medical system. Instead of having 1 million cases in 2 weeks, we have 1 million cases over 6 months. The real goal was to allow time to raise medical capacity, refine treatments and testing strategies. But the goal was never to expect that we could flatten the curve to 0 cases, or to wait until there was a vaccine, because unfortunately in medical and economics, these just aren't feasible expectations. There is a lot of concern about reopening the economy, and this concern is extremely appropriate. However, the question is not if we reopen, it's when we reopen, and then to what extent. But whenever we relax these restrictions, be it in 6 days, 6 weeks, or 6 months, we will see a second spike in cases. The goal is going to be to open things up slowly with good strategies so that we keep that second spike flattened as well. Now, we're all hoping that these restrictions get lifted soon, but we need to wait until we have the appropriate medical infrastructure in place to handle it. Now, what exactly needs to be in place is going to be up to the governors, but it does seem reasonable that some businesses in some areas can start to reopen very soon, but with appropriate measures, masks, distancing, etc. However, we do need to have realistic expectations and an understanding that whenever things are relaxed, there will be risk that we will need to accept, and there will be a spike in cases at that time. I'm here today with Dr. Andy MacBride. Now, for any of our patients watching, you probably recognize him because he's the resident who does some training in my office and plans on completing a fellowship in pulmonary critical care medicine. However, he's not been around that much lately because he's pulled back into the hospital taking care of the COVID pandemic. Now, unfortunately, after being on the front lines taking care of the sickest of the sick, he did become sick with COVID-19. So Andy, what happened that necessitated you to become tested? Was there an obvious exposure? Was it just symptoms? What happened?
Yeah, there was no obvious exposure necessarily. We're still not 100% sure where I contracted it from. But I initially started off with some sinus congestion, a very bad sinus headache, that then progressed about 2 days later to 101.1 fever that prompted me to get the test.
Yeah, it doesn't seem like the usual symptoms, but it seems like you're making a pretty good recovery. What's your trajectory? When do you think you get back to work, or are you going back to work? How's that happening?
Yeah, it should be very soon. Typically about 3 days without symptoms is what they really like to see, and then I'll have to get another visit with our occupational health from the hospital to fully clear me, but that should be probably sometime later this week.
Great. All right, now you're pretty young and healthy. How old are you?
28.
28. And if you want me asking, do you have any pre-existing conditions, underlying health problems, anything like that?
Not for me, no. I'm otherwise pretty healthy. My wife, on the other hand, has asthma, and unfortunately I did pass the virus to her as well.
Ooh, now, asthma, we get that a lot. I mean, I hear a lot of people that have asthma and they're concerned about getting it. Knowing your wife has it and she has asthma, how's she doing?
She's actually doing very well, similar to me, similar path as me. She did develop a little bit more of the respiratory symptoms, a little bit more of a cough, some shortness of breath with activity, but pretty mild otherwise, and she's already starting to turn around and get better herself too.
It's great to hear. It's great to hear. It seems like you guys are both making a really good recovery and on a path to being able to get back out there. Now, I know you haven't been out there in about a week, but what was it looking like in the hospitals from your perspective? I mean, I've talked about it from what I've been seeing in some of the hospitals and places I go to, but are you starting to see the admissions tapering down, going up? And what about the level of critically ill patients?
Yeah, I definitely been seeing the admission rates coming down. Pretty much all the patients that do come into the hospital are related to COVID, but the numbers are coming down. The rates of people going on ventilators in the ICU is starting to stabilize and level off. And we're not seeing the huge spike that we were before. And we are seeing a lot of success stories of people coming off the ventilator and doing well too. So we're definitely seeing a trend in the right direction.
That's great. That's great. I mean, I can say that, you guys, intensivists there, are just doing an excellent job. I'm happy to know you guys and work with this. So, I mean, I'm thrilled to hear you're doing as well as you are, and your wife too. And also even proud to hear you're ready to get back out there on the front lines as soon as you can, and you're healthy again. So, happy to hear that, man. I'm glad to hear that, and hope you continue on full recovery. And if you need anything, you let us know. Take care, okay, bud?
I appreciate it. Thanks for having me.
All right. Hope to see you back in the office soon, man. Thank you all for tuning into my update. If you like these videos and would like to check out my previous and future updates, please follow us on Facebook and YouTube for all of our content. And as always, please remain safe, healthy, and please be smart. Millions of Americans' health, lives, and jobs are depending on you to continue to do your part. Thank you, take care, and God bless.